Style is
Hi, so today let's talk about occupational health and safety. Many previous studies have reported that occupational health and safety enforcement is poor in developing countries like the Philippines. Let's talk about the problems, issues, and challenges associated with OSH conditions in the Philippines. So first is child labor. It is said that out of 250 million child laborers, 3.7 million of which are from the Philippines. So with this being said, employing children at a very young age greatly affects the quality of work, their health, or even can cause to death. Okay, and then the next one is the pesticides in farms. So this is one of the other issues that the OSH is experiencing in the workplace as well. It's because a farmer who handled pesticides may be unaware of the hazards that it belongs to, because there are some residues that they might be getting on their end, and then once they go home, it could like take place to their, or it could pass in their family or even in the community. So it's really important as well, or as much as possible, to minimize the use of the pesticides and just do the organic way of farming. And then lastly is that the women worker issues. So on this regard, so women often faced with a lot of burdens, like considering they have a role to or they have like a role to perform at home, being a wife and a mother. And then this being said, this could actually affect their performance at work, especially if they cannot handle the stress that much. So this could affect, or the hazard that they are exposed to is like their reproductive health, and then for pregnant workers, the unborn child. So yeah, those are just some of the major problems that the occupational health and safety are experiencing too. We as a Filipinos, as much as possible, we would want to minimize the accidents or what's happening into the workplace, and just have a healthy working environment, because one life is a loss to many. So it would be much better to stay healthy, be safe, to have a wonderful life.